Speaker sir, I have seen that the premium paid is almost 52 crores. There are claims, almost 7,346 claims, which must be valuing to around 26 crores. But from what I am given to understand that GMC was also part of the scheme. GMC has not raised claims. Why is that? Why is the GMC? Why is that? Do you require somebody else to do it? Or you appoint me, I will sit there and do.
Yes, sir.
Do it properly. Why they are not doing? Tomorrow the insurance company will say, no, let me finish. Tomorrow the insurance company will say that no, it is lapsed. You can't claim now. Why are these claims not going from GMC? Because that was GMC, all hospitals are part of it.
माननीय मंत्री उत्तर देऊ नहीं.
Question is उत्तर
चाललो नहीं.
Speaker sir, I agree with honorable member that there are certain deficiencies, certain things have to be done from our department also. So we are on it. Last 2 months we have been seeing, and we have also talked to the Director Health Services to move a fresh file to see what needs to be done. But apart from it, like the member said that already the total premium paid was 52 crores. Total claim received as on 27/2017 was approximately around 38 crores, and total claims paid out is around 26 crores in 31 lakhs and odd. Total number of money paid out to government hospitals is for about 1,128 cases, which is around 7 crores, and private hospitals 19 crores. So that gap is there. So I am working on it. Let me just find out what are the problems that we are facing or what has not been done, if you are saying from GMC, and we will rectify this. But be rest assured that whatever shortfalls are there in this scheme or whatever modification, there are no, that you cannot say shortfall. This is a unique scheme which has been tried out, and Goa is the first state to try it out. And like I said, the Chief Ministers know of most of the whole concept, the whole thing behind it, and so that maximum benefit goes to the people. So we will, like you said, we were going to sit down and going to see what all additional things we can add on into the schemes and ensure that if there is any deficiency or bills are not raised by Goa Medical College, why it's not being done, we will definitely look into it, and I will keep you posted exactly what has happened and what are the reasons.
Goa, almost 34 hospitals have been, I don't say benefited from this scheme, but they have used their services in giving people of Goa have benefited from this scheme. The burden on GMC was supposed to be less, but the burden is still continuing because patients are still increasing. Speaker sir, 34 hospitals, I will not name of them, Apollo Victor, now Rajgiri, Dr. Gracias, Kampal Clinic, Chodnagar Hospital, all so many hospitals are there. Speaker sir, I only want to ask one thing from the Honorable Minister. Is such hospital, you have said that you will try to increase the number of hospitals by looking into the teething problems of whatever it is. But I want to ask you also, when you are going to do this, whether you will make a mechanism when these other hospitals and this hospital, because I have seen from the last 1 year experience that people go and reach in the evening or night, whatever time, they have the card with them, but they are unable to use it because the people in that particular hospital are not able to communicate to them that this procedure is there or not there. Whether such teams will be there or whether you will make this insurance company some sort of a call center or something where people can call and ask whether your PROs which are doing more work in GMC, whether you are going to make them work on this line.
We can definitely look at having a small call center set up where all these clarification and specifically all these hospitals that are listed, so that to make those hospitals also aware that this thing is available in that particular hospital, so that the patient doesn't have to run from pillar to post with that particular card or not get benefit of the card which he is entitled to get benefit of the card.
I have got a list of 29 cases which were rejected. That is one list, but there must be so many other cases which are rejected, which are not come officially to you. Kindly look into that, and whenever you are making the committee for looking, kindly include me so that I can give my inputs. I have a lot of inputs to give you.
Sir.
Thank you, sir.
I would like to assure the honorable member, if he sends me the list of cases, I personally will examine each and every case and explain to you what was the situation. If something has gone wrong from our side, we'll see that we can...
No, not from your
side.